Welcome, everyone, to today's Explainer. We're diving straight into a topic that, is sometimes seen as a bit sensitive, but it is absolutely universally crucial. We're going to explore men's physical and mental vitality, specifically after crossing that 40-year milestone. It's a fascinating subject that really touches on biology, psychology, and everyday lifestyle. And we're going to break it all down so you have a crystal clear understanding of what's actually happening inside the body.
Here's our roadmap for today. We'll be covering the universal aging challenge, the modern science perspective, and ancient traditional medicine insights, before moving into practical exercises for vitality, clearing the body's flow, and finally, redefining masculinity and mindset. Let's get right into it.
Section 1. The Universal Aging Challenge, because it's really not just about getting older.
In our source material, there's a really striking contrast. On one hand, we see reports of men nearing 60 who are feeling absolutely fantastic, just totally full of energy. But on the flip side, we have a guy who's only 37 years old, expressing deep anxiety about his declining vitality. Highlighting this is so important because it proves that the anxiety around declining energy is a broad cross-generational issue. It completely shatters the stigma that this is just some old man's problem. This touches on both physical and mental health across a massive spectrum of ages.
So that brings us to the ultimate question, right? Is aging always just this inevitable downhill slide? Well, the answer we're going to uncover today is a resounding no. We can actively manage and understand our biological changes rather than just throwing our hands up and accepting defeat.
Moving right along to Section 2, the modern science perspective, biology, hormones, and the data.
In the medical world, this condition is known as male andropause. Giving it this clear diagnostic label is actually incredibly helpful because it removes all the guesswork. Now, unlike female menopause, which is often a very sudden shift, andropause is a gradual, measurable decline of the male hormone testosterone. And the best part? It's not a mystery at all. It is highly diagnosable through a standard everyday blood test. Once levels drop below a certain normal threshold, well, doctors have a clear scientific basis to begin intervention.
But what does this actually feel like on a Tuesday afternoon? The sources point out some very specific physical changes. Notice how a drop in testosterone affects the entire body system. It's really not just about intimacy. We're talking about a sudden tendency to hold on to belly fat, a persistent, lingering fatigue that you just can't shake, a noticeable loss in muscle mass, and even psychological shifts like mood swings and anxiety. This clearly shows us that hormones are basically the master conductors of the entire body.
To put this into a practical perspective, our sources highlight Professor Tran Quan On's Rule of 9. It's this fascinating, memorable little mathematical tool to help men logically gauge what is biologically appropriate for intimacy based on their specific age. It works like this. You take the first digit of your age decade and multiply it by 9. So if you're in your 50s, 5 times 9 equals 45. That translates to a baseline frequency of 4 times every 5 weeks. In your 60s, 6 times 9 is 54, meaning 5 times every 4 weeks. It's really just a helpful logical reference point to understand your body's changing rhythm.
Okay, Section 3, Ancient Traditional Medicine Insights, focusing on the flow of qi and blood.
Now this is where it gets really interesting. It's a beautiful contrast between the isolated modern focus on hormones and the ancient focus on the interconnected balance of the body. Where modern science zooms way in on testosterone levels, traditional medicine zooms out. They look at the flow of qi, or energy, and blood, and how organs like the kidneys, heart, and spleen are interacting with each other. It's a completely holistic view of the machine.
Traditional medicine uses the term zheng jiang ni to describe a lack of vitality or impotence. But catch the distinction here. They do not see this as a localized issue at all. They view it as a systemic, whole-body imbalance. Traditional practitioners look for the root cause of systemic weakness, rather than just patching up the surface symptoms. If the leaves of a tree are withering, they look at the soil and the roots.
Let's talk about a specific study of 375 patients detailed in the sources. Nearly 65% of patients diagnosed with vitality issues suffered from what is called nuenzeng batuk, which basically translates to a profound lack of foundational core energy. Another 35% showed heart and spleen deficiencies linked to anxiety and digestion. The sources also note that in the most severe cases, almost all patients fell into that 65% category. This just proves that external symptoms are deeply rooted in an internal, foundational deficiency.
All right, Section 4, Practical Exercises for Vitality and Rebuilding Core Strength.
So what can we actually do about this right now? The sources lay out 4 highly effective, practical exercises to rebuild your core energy. First is the plank, an incredibly simple but powerful way to build total core stability and posture. Next, crunches help increase overall stamina to fight off that persistent fatigue we mentioned earlier. Third are lunges, and I have to say, the blood-pumping action of the lunge is phenomenal. It essentially acts as a mechanical pump driving circulation directly down to the lower body. And finally, Kegels, which is an often overlooked exercise that directly strengthens the pelvic floor for immediate functional control. The effectiveness of this combination is seriously no joke.
Which brings us to Section 5, clearing the body's flow using the irrigation canal metaphor.
I absolutely love this imagery from the sources. Think of your body like a giant irrigation canal. Desire is the fire, but your blood vessels are the fuel pipes. If mud, fat, or inflammation block those fuel pipes, just like a clogged canal stops water from reaching the crops, the fire of your vitality literally cannot burn. You absolutely must clear the blockages for the fuel to reach its destination.
And to help clear out those blockages externally, traditional practices suggest a natural topical therapy. It involves warming and massaging a combination of 2 specific oils. Castor oil acts as the deep penetrating carrier, reaching in to nourish the tissues. Then, pine oil is added as a softening agent that actively reduces inflammation. By combining them and applying a gentle massage, it's believed to help break down those hardened tissues and restore that vital circulation we just talked about.
Finally, Section 6, redefining masculinity and mindset, the psychological anchor.
Here's the really crucial takeaway from all of this material. True masculinity, your value as a man, cannot simply be defined by a biological function or a hormone level on a blood test. It's built on courage, love, and deep self-respect cultivated over years. The ultimate goal here isn't just about trying to turn back the clock. It's about how wisely, how healthily, and how confidently a man masters his own aging process.
And that brings us to the end of our explainer today. We've looked at the measurable data of modern science, the holistic energy systems of ancient wisdom, and the practical steps to rebuild your physical and mental foundation. So, armed with this knowledge, I leave you with this. What will be your starting point? Where does your personal journey to better health begin today? Thanks for joining me, and keep learning.